Hi, everybody. Hi, Atarah. Can you hear me?
Yeah. Can you hear me?
Yes, very clear. Okay, we'll just wait for.
I have to go and put a hair gel.
We'll wait for some people to join first, and then we'll start the questions.
Okay.
So, have you had your dinner?
Yeah, I have a quick one. I today everything all very early. So later I'm going to because later I'm going to join my friend for the staycation.
Oh, nice. Where are you going?
Park Royal.
Oh, nice. Wow. On a weekday? Not bad.
They will stay until tomorrow.
I see. Okay.
I
Nice to enjoy.
I can't be bothered. I can't be bothered until tomorrow. I just go there a little bit, drink here, drink there. So you are dinner already?
Yes, so we now have about 7 people, and then I've just sent to the groups to tell them that we'll be online. So anyway, after we're done, this video will be saved, and we will put it on all the social media sites.
Okay, so you do I get the
yeah,
okay.
I'll share it. I'll share the link with you, and then you can share it on your sites as well, and your Instagram and everything. Yeah.
Can.
Okay, I think about a few more minutes, and then we'll start with the first question, and like the introduction and everything. Great.
So you can hear me very clearly, right?
Very clear.
I think that means my phone is perfect.
I'm using headphones just in case.
No. I went to upgrade my phone to Galaxy, the latest one.
Oh, nice. The Samsung one.
Yeah. So then the hearing is actually I don't need to use earpiece.
Wow, that means it's not bad. But your background must be quite quiet, right?
Very, because I chased everybody out and my nephew locked them inside the room.
I've also locked my kids inside the room as well. So they won't be. I don't stay there until I'm done. Exactly.
Let them play computer game.
They're watching TV. Yes. Okay, we have some more people joining us. Oh, let me go and get I'll go get the vitamins so that people can just have a look at it later. Okay. Okay. All right. Okay. I think maybe we can start now. Okay. Ready?
Yeah. Okay.
Okay.
How many people is already on the?
Okay, we have about 17 people online now. Okay, and I'm sure people will, as we keep on talking, people will join as and when. So then if they have questions and everything, they can. So okay, so thanks Atarah for joining us today. The main topic today is basically the differences between probably IVF, IUIs and everything at a public hospital and a private clinic. Right?
Yeah.
So Atarah is from Sincere Clinic here in Singapore. Atarah, would you like to maybe give us a short introduction about Sincere Clinic before we start?
Okay. Hey, hi everybody. Thanks for joining us. So today we are actually sharing with you the difference between private hospital and a public hospital and a public clinic. Okay, so I just give you a short introduction of a Sincere Healthcare Group. Okay, I think some people they still do not know Prof. Sun Chai. Okay, so Sincere Healthcare Group was actually established in 2010. And we actually, until now, we are actually nearly to 11 years. And I believe most of the patient or most of the viewers who actually who has actually visited or doing some research, and they all know who is Prof. Sun Chai. So Prof. is actually the father of IVF in Asia. Okay, so that is actually due to his success in starting the first IVF program in Singapore. That was in 1983.
Okay.
And he is also our IVF medical chairman.
Oh, okay. The chairman of the IVF Center.
Sincere IVF Center.
He's the chairman. Okay. All right.
Besides he's a medical chairman, he's actually on hands-on.
I see. So he's still doing
Yeah.
all the procedures and everything. Okay, great.
Yes.
Okay, so let's start maybe with our first question. Okay, so
Sure.
I think obviously when somebody goes to your clinic, okay, or goes to a public hospital, the first thing that they will do are fertility checks. Okay, so how do fertility checks actually differ between your clinic and a public hospital?
Okay, firstly, for us, we have our own lab to do all tests, semen tests, you know, and others clinic usually they have to send to others lab. So
Okay.
Prof has actually developed his own in-house lab to do tests for male sperm. Okay, and including a few more sperm tests such as DNA, fragmentation, OSA, and HbA.
Okay, all right. DNA fragmentation, OSA, and HbA. Would you be able to explain these tests? So these tests are only done at your clinic. Would they be done at a public hospital?
No.
Oh no. Okay, maybe could you explain further to these about these three tests?
Okay, for DNA.
Wait, sorry. This one is for men, right? You're talking about men, right?
Yeah.
Okay, all right, okay, yeah. So what would a DNA fragmentation be?
The DNA fragmentation is actually to check the genetic material in the sperm, okay, which actually can lead to male infertility.
Oh, wow, okay. And then OSA, is it OSA? Oxidative stress assay, right? That's what it's called.
Yes.
Okay,
so
and what
actually,
is that?
OSA is actually a test of the liquid in which the sperm travel in when a man ejaculates.
Oh, okay. Okay, interesting.
Yeah, so this measure the oxidants and antioxidants in the system.
Okay, so that's OXA. And then there's one more HbA, is it?
Yes. And okay, for HbA check with the HbA investigation is actually on the maturity of the sperm in a fresh semen sample. So this is actually to predict the sperm performance and fertilization potential.
Okay, so let's say if a man comes in, right, and he has basically a problem, like one of these problems and this and that. So how would you guys suggest to fix this problem first, or how would you suggest to fix this problem?
Okay, for DNA and HbA, we work on improving the quality of the sperm through the supplement with supplement and with OSA. So if let's say example there is a problem with the liquid, so actually what we do is we will provide the man with a container that is actually full. Will be full of a special liquid where he needs to give his sperm for fertilization.
Oh, so that means, okay, so just to clarify, so that means on the day of fertilization, when there's the egg retrieval or whatever, when the man gives the sperm, the container that he ejaculates in is not an empty container?
No.
Oh, so it will have a special liquid. And what does that liquid do?
The liquid actually to give the sperm a better chance of surviving and to improve the fertilization process.
Okay, that's very interesting. Okay, so then now comes obviously pricing. Are fertility checks more expensive at a private clinic than a public hospital?
Okay, actually it's not.
Okay, all right.
Actually, it is more affordable as because firstly we have our own labs.
Okay.
So you know that when you let's say when you send any sample to any others of the lab, right? Definitely there will be charges.
Yes.
Yeah. So for us, we have our own lab. So for example, our current fertility package is actually 630.
630. Okay, that's quite fair. Yeah. All right. And then what does that include?
And this is actually includes for female and female checks, including the one. Yeah, including the one that I mentioned just now. Okay. And this this fertility package is actually come with one-time consultation with Prof.
And so how much is this, Prof? If you don't mind sharing, how much is this consultation usually?
Consultation is actually 200.
His initial is $200. Okay, all right.
Yeah. So the 600 is already actually inclusive of the consultation. It's either you can choose Prof or because anyway you are just starting to have the fertility package.
Yeah.
You are not you don't start anything like IVF yet. So you can actually we can actually dispatch you to any of our fertility specialists.
Oh, okay. So you have more than one, is it?
We have more than one.
Okay. So basically, so 630, just now you said 200. So essentially the checks is about 430. But if we don't go through this package, let's say if we only want to do like certain, how much is this package normally?
If you go by a la carte, it would be 1,550, and that is exclusive of GST.
Exclusive of GST. Oh, okay. So it's 1,550 plus GST, and now it's 630. Okay, all right.
Yeah.
So, but at a public hospital, how much would you pay at a public hospital?
For public, usually it's about 800 to 1,000 range.
Okay. So that means technically
and they are not inclusive anything of inclusive of the OSA. OSA is actually a test that only in Sincere in our clinic we do run this test because Prof is very particular.
I see. Okay.
Yeah.
All right. Interesting. Okay. Okay. Just now previously you mentioned supplements, okay? When we're talking about supplements and everything, just now you said that, let's say if they need the male sperm or whatever they need improvement, supplements, what kind of supplements would you guys recommend? Would it be over-the-counter supplements or, I mean, what kind of supplements?
Okay, the supplement is actually rather unique because Prof actually Prof himself with a bunch of scientists have actually developed this supplement called Ovule Health.
Ovule Health, okay.
So this supplement is actually usually gets both male and female patients to take a period of time before they start fertility treatment. Okay. And for normal supplement that you can get sourced from outside, usually you take about 3 months to see a difference. Okay, but for Prof, that the supplement that Prof that we are having is called Ovule Health. We have experienced that patient. We have actually 3 or few patients where they are actually unable to conceive for about 10 years, 12 years, 10 to 12 years. And mainly they fall into the criteria of unexplained infertility. Okay. So surprisingly, it works very well. And patients who actually they took this supplement for about 1 to 1.5 months, and they naturally conceive. So they save the IVF treatment. So you're talking about the person who couldn't conceive for 10 years, they took and then they conceived. Yes, yeah. Wow. Yeah. Okay. That should go by as well. Yeah, actually, three or 4 patients actually successfully natural conceive. So are you saying that if we take these supplements, we don't have to take anything out, or we can eat hand in hand with our own supplements as well? Because I mean, we obviously take a lot of supplements when we are going through a cycle and this and that. I think this one actually Prof will give you better advice. Okay. Yeah. All right. Yeah. Interesting. Okay. All right. Okay. Next question. Now let's talk about procedures. Okay. In comparison, okay, in a public hospital, because obviously I've gone through IVF at NUH, okay. For example, in NUH, the procedure of IVF takes about 3 to 4 months. So the first month I started with noresteron, so to control, it's like it controls your period or your cycle and everything. And then the second month I started my stimulation injections and then did a retrieval. And then third month, an endoscratch. And then fourth month, a frozen transfer. So about 4 to 5 months we're looking at. Is this similar at a private clinic? No. For private clinic, it's actually much faster. Okay. All right. Yeah. Because firstly, we do not use drugs like norestosteroid, which is a birth control pills to control your cycle, you know. Yeah. And we have to wait for the cycle to come naturally, and then it start to stimulate. To do the stimulation injection on the second day of the cycle. Oh, okay. So that means we don't take noresteron. We just wait for the period to come. Yeah. Okay. But what happens? Okay, sorry. You go on first then. Yeah. Okay. So the endoscratch will be done at the same time, straight after the egg retrieval, while the patient is under the so-called the GA. Oh, okay.
So that means instead of waiting 1 month later to do the endoscratch, they will do it at the same time as the egg retrieval. Okay, so that saves a month essentially.
Yeah, so this is actually to save the time, the cost, you know, and also
the operating
in the next cycle. So in the next cycle, the frozen transfer will be done already.
So basically, that's 2 months.
Yeah.
Okay, so 2 months as compared to 4 months. Just now you were talking about waiting for the cycle to come naturally, right? So what happens when so if our cycle comes, do we call the clinic and tell them, okay, my cycle is here, I can start injections, or how does it work? Because what happens if you guys are too busy?
No. Firstly, we have a we have a back-end call center.
Okay.
I think some patients will actually, you know, they like we have patients who actually contact us in the middle of the night, 1 a.m., 2 a.m., 3 a.m. Yeah, so
to tell you they have their period.
Yeah. Because firstly is I think everybody they are actually you know especially for those female where they waited so long and they really looking forward into conceive to have their own child.
Yeah.
You see, yeah. So of course we are actually 24 hours serving our patient, even regardless of what time they call.
Okay. So, we just have one question. Why does public hospitals wait another month to do the endoscratch? Okay, so when I did it at NUH, they said that they, because they have time limits for basically the egg retrieval and they have a schedule to follow, so they usually prefer to do hysteroscopies or endoscratches a month later. So that's what I know about public hospitals, yeah. So, I mean, if a private clinic can do a endoscratch at the same time as an egg retrieval, it definitely would save a lot of time. And I guess it would also save the operating theater cost as well, because we would pay double cost to do an endoscratch at a hospital. Okay, interesting. All right, great. So, in terms of, let's get to the labs and embryologists. So just now you guys said you have your own labs, okay? How would your lab and your embryologist differ to public hospitals, the ones at the public hospitals?
Okay, at Sincere, our embryologist has been there since day one.
Okay.
Yeah,
how long is that? Sorry, day one is
more than 10 years. 10 years.
Okay.
Since the day Sincere we started to have all these necessary department, equipment, you know, and they are all trained directly under Prof.
Okay. All right.
Yeah, so Prof. He has a lot of experience and he's actually good at what he does, and he know what he need to do.
Okay. All right.
Yeah.
So, okay, in terms of, let's say a 3-day and a 5-day blast, would Prof. Ng be okay to do 3-day? I mean, does he usually grow it to 3-day and he can freeze it, or does he grow it to 5 days?
Okay, Prof has a very good understanding on how he can help embryo to grow past their initial 3 days. And that is why we have a high success rate of getting embryos to 5 or 6 days blast.
Okay, interesting. Okay.
So apart from that, right?
Yeah.
We are also the pioneer who actually brought in the first embryoscope machine in Singapore.
Embryoscope machine. Okay.
Yeah.
So you guys were the first one in Singapore to bring it in.
Yeah.
Interesting. Okay. In terms of procedures, okay, for example, there are some clinics who would go to so they go to the clinic will all arrange for them to do their procedures at a hospital. So how about for your clinic? At the hospital, are the procedures done at the hospital itself or at the clinic?
Oh, we actually own our own IVF operating theater. So the patient, we don't have to trouble patient running here and there, you know. So everything is basically is on one-stop location.
So they just go there and everything can be done at the same place.
Yeah.
Okay, all right. Okay, one question that we had is patients with low AMH. Okay, obviously there seems to be more and more people as the age gets older, that AMH, which is low ovarian reserve, they experience low ovarian reserve. Would they stand a better chance going to a private clinic?
Oh, of course. Because I think because of what I know in public hospital, usually they do not change the protocol of the patient much after a few of IVF cycle.
Okay, yes, true.
At private clinic, we will actually look at patients' record and medication that they were given previously.
Okay.
And we will then change it to see if the result actually can improve or not.
Interesting.
Yeah, and also we care a lot of getting embryos to 5 to 6 day plus to freeze so that the embryos are at the best stage for transfer to the patient.
Wow, okay.
Yeah,
all right, what happens? Okay, yeah, sorry.
We also have a number of female patients who are actually have a low AMH, who have already retrieved a 1/8 and still able to get that 1/8 plus.
So that means they retrieve 1/8 only, and that 1/8 can get to blast. That you very seldom hear about things like that. So that's quite interesting. Okay, all right. In terms of once let's say they retrieve, like, does the embryologist do anything to help it grow, or I mean, how does it work there?
Oh, embryology job is the most important, in this IVF. Okay, that is because the embryo is usually grow on its own, okay, for the first 3 days. And then from there, the embryologist will actually come in to help to grow. Okay, so we also do assisted in hatching, where we see suitable to help the embryo even more. So the chances of having successful conception is actually higher.
Understand. Okay, so when you talk about successful conceptions, would you be able to share your clinic success rates, according to probably ages or whatever?
Okay, the range, from 30 to 35 is about 70 plus to 80.
70 plus to 80%, okay.
And
35 to 40?
35 to 40, about 70, 72 like that.
70 to 72. Okay, all right. Do you have 40 to 45?
40 to 45 is about 52%.
52%. How about older than that? I mean, I'm sure you would have patients.
The older one, the 45 to 50 is about 2%.
Oh, only 2%. Okay, all right.
And we have few are actually even older than 50. Yeah.
Wow. Okay.
Yeah.
So we are talking. Are these live births or successful conceptions?
They are live birth. We calculated as live birth.
Live births. Okay. All right. So then I guess successful conception will be higher than that. Okay. Interesting. Does your clinic do? Okay, sorry, we have one more additional question that is kind of it. Are there additional costs for using the embryoscope?
No.
Oh, the embryoscope machine. So everything is included?
Yes.
Okay, all right, okay. Finding coconut, I hope that answered your question. Okay, does your clinic do fresh transfers or only frozen transfers?
Okay, for Prof, he's a believer in frozen transfer.
Okay.
The reason why, because there have been a higher success rate with frozen embryos.
Okay.
So usually we will only do frozen embryo transfer.
Okay. But in a worst case scenario, can fresh transfers be done, or?
We have to look at the condition.
I see. Okay.
Yeah.
For frozen transfers, do you guys do any unmedicated frozen transfers or only medicated frozen transfers? This is one of the questions I was asked.
This actually depends on patient request.
Okay. So if a patient requests, they can?
Yeah, but it's actually very rare.
Oh, okay.
Because we have to make sure that the patient's body is actually prepared for the transfer. Okay. So the best way to do it is actually through medicated
transfer. Okay. Is PGD, PGS testing available at your clinic?
Yeah. We do. Yeah,
in
but
Singapore?
No. But the embryos will have to be sent to JB in Malaysia. We have another branch in Gleneagles, Medini.
Gleneagles, Medini in Malaysia. Okay.
And we also have a lab over there.
Okay. So how long has Prof had a lab in Malaysia for?
About 6 years.
Oh, okay. So after, let's say, so you're saying that they'll send the embryos over to Malaysia, JB, to get it done. Can they be sent back to Singapore?
This is actually, this one you need to seek approval from Ministry of Health, MOH. So usually what we do is we will actually have to write to MOH to ask for permission.
Oh, okay. Mm-hmm.
Yeah, and only upon arrival, then we can send them back.
Approval. Okay, all right.
Yeah. So otherwise, you will have to wait until the borders open for patient to go in to do the transfer in Malaysia.
Wow. So we would have to, we would not know when that would be, right?
Yeah, for patient who are actually very keen in doing PGD, so you pray that the border will open.
I also pray harder so I can go shopping inside. Okay. Do you have the cost? How much was it? Is it to do PG testing in Malaysia?
Usually it's around Sing dollar $10,000.
$10,000. Wow. Okay. All right. So, okay. Somebody asked this question. If a patient has approval to do PGD testing in Singapore, so they've written they have genetic or hereditary conditions, are they allowed to go to a private clinic, retrieve the embryos, send it to, let's say, NUH, and then get it tested and then bringing it back? Or how does that work?
Okay.
Can it be done? Can it be done?
It can be done, but at this point of time, our clinic has to submit documentation. You still have to go to MOH approval.
Okay.
Yeah, to retrieve the PGD biopsy sample at our clinic in Singapore.
I see. So, so your clinic is allowed to do that, or they're still waiting for approval?
We are waiting for approval.
Oh, okay. So, okay, understand. So let's say if it can be approved, okay, so let's say if it is approved and people can do it, what would the procedures be? Would you know?
Okay, the procedure will be done as a complete IVF at a private clinic. Okay, so clinic will actually culture biopsies to day 5 or 6 plus.
A blast, okay, all right.
Yeah. So then we will do the PGD biopsies and then freeze the biopsies embryos.
Okay.
We'll actually send to biopsy sample for testing. Then once the result is back, so patient can actually go back to their private clinic to choose which embryos they would like to transfer.
Okay, so just to run, so that means you're saying is that they can go to a private clinic, retrieve the embryos, and then basically you guys will take a biopsy, okay, and then send the biopsy to a public hospital. And then after it's been tested, the patient will come back, get the results, they'll come back, and then they'll choose what to transfer.
Yeah.
Okay, all right. Oh, that's quite good then. So, I mean, somebody who has genetic problems, if you guys are approved to that, they can go and proceed to do, they don't have to just do it at a public hospital. Okay, all right. Do you know the cost? How much it would cost to do that?
Not sure. This is also depends on, because every patient, they are rather unique in their medical condition. So it depends on their, depends on each of the patient's condition.
I see. Okay, all right. Okay, next question. Because, okay, so I don't know if you know, but NUH is actually closing its labs for 6 months. So there are actually a lot of patients who have frozen embryos sitting at NUH. Okay, does your clinic accept frozen embryos from public hospitals?
Yes, we do. Recently, we have many patients actually coming in to us.
Okay. Yeah. Obviously.
So even today, I still have I still receive quite numbers that actually making appointments to see Prof. So definitely we do. So the patient will actually definitely before any process, any transfer done, definitely the patient need to seek a consultation with Prof first.
Okay.
It is actually to let him to know to know that they want to bring the embryos over, and then there are some procedure and arrangement and the necessary paperwork to be done and to arrange the transportation.
Oh, okay. Okay, all right. In terms of transportation, I've actually, so we had, okay, one of our stories on the Instagram, there was a lady who, she brought embryos over from a public hospital to a private clinic, and the embryos were actually, how to say, it was destroyed during transportation.
Oh.
Okay, is this something that happens quite often, and would you refrain from something like this happening?
Basically,
because they're very precious at the end of the day.
Yeah, for us actually, we are we can say we don't have any such case happen in our during this type of transferring, destroy of others embryos. You know, that is because we have our own transportation,
okay.
and they are very reliable. We do not use any outsourced transportation service because we do not know. Yeah, we have our own, and we also do not, when we get a new transportation service, we do not know how good their service, so we will never take risks. Yeah, because we also because anyway we used to have like, you know, before the COVID, we also have done like Singapore to Malaysia, you know, and we also have others so-called the country that is actually the counterpart with us. Yeah, so we are actually we are extremely very careful.
I see.
It's actually can actually destroy a reputation though.
Yes, absolutely. Because I mean, embryos are so precious, and if you only have one or two and during transportation,
the embryos is actually more to like a go by, you know.
Absolutely, that's right. Okay, somebody just has a question. Just now, coming back to the just now we said that transferring frozen embryos from public hospital to private clinics, how long would the documentation take to transfer it over?
How long?
Yeah. So that means the preparation for your company, for your clinic to prepare documentation to transfer it over from let's say a public hospital to your clinic. How long would it take usually?
It depends.
Okay. All right. Maybe you can check this one and let us know, and then we can share it with our. Okay. All right. Okay. Just now. Okay. So coming back to transferring embryos, how much are we looking at? The cost to transfer it over?
Okay, the cost is around 100 Sing dollar for transportation.
Okay.
And 400 Sing dollar for annual storage fee for embryo, regardless of the numbers of embryos.
So if somebody has one embryo, it's also 400. They have 10 embryos, it's also 400.
Yeah.
Okay. Interesting.
So
and then
after that, the FET cost is around 4,000 transfer.
That was the next question I was going to ask you. Okay. So then frozen transfer. So okay. So that means they will bring their embryos over. That will cost $500. So 100 for transporting, 400, and then another 4,000 to do the frozen transfer.
Yeah.
Okay. All right. Okay. So then, okay, let's now talk about one of the most important things. Okay. I think a lot of people, their main concern of going to a private clinic would be cost. Okay, so let me share with you. So for example, at NUH, right, average IVF cost there is about 15 to 23,000. Okay.
Yeah.
However, after minusing government grants, it's about 7,000 to 15,000. Then we still have MediSave that we can minus. So sometimes it's nothing, out of pocket is nothing, or sometimes about 3,000 to 4,000. For me, because my husband is a Singapore citizen, I'm a Singapore PR. It cost me, I think, about 4,000 for my IVF cycle. So how does that compare to a private clinic?
Okay, first and for all, definitely, I think everybody know anything that is actually belongs to public public hospital, right?
Yes.
It's a waiting list, correct?
Okay. Yep.
Okay, for private clinic, okay, in our clinic, our cost of IVF is around 18 to 23,000 for average case. 18
to 23,000. Okay. All right.
Yeah. Unless cases that are very complicated, so it can actually go up to 25K.
25,000. Wow. Okay. All right.
And this is actually before MediSave deduction.
Okay.
Yeah.
So
So
okay,
after
yeah.
the so after the deduction, after the deducting of Medisave, right? So it's around 12 to 19.
12 to 19. Okay.
And
Wow.
currently, we are actually running a IVF. We are running a 3-in-1 pandemic, so-called IVF package.
Okay. And is
So
there
this package actually, yeah, this package actually helping those couples who actually they wanted to start a family now, and we offer beside all these things, so they also receive a 5% discount from the total bill.
so total bill as in the total bill for IVF?
Yeah.
Okay. All right. Interesting. Okay. Payment methods. What payment methods are there? I know because you see, when we go to NUH, basically everything is kind of not paid for until right at the end. Then you'll pay for because they know that there's deductions to be made. But at a private clinic, how do we pay?
Okay. Usually we receive we collect, our collection is either cash or credit card.
Cash.
Yeah.
So they are different. That's a lot of cash. Okay. And then Medisave. You say we can deduct Medisave. How can we deduct Medisave?
So okay, so after making payment, right, the clinic will actually process the claim from the Medisave, and after about 1 to 2 months, then we will actually issue the check back to the patient.
Okay, so whatever is Medisave deductible, they'll give us back the money in 1 to 2
This
months
is
later.
actually for Singaporean and PR lah.
Yes, correct. Because only Singapore parents have Medisave, correct.
Right.
So, I mean, overall, it is still a very big difference in cost. I mean, why would your success rates be higher than a public hospital, and why would somebody choose a private clinic, seeing that it's really quite expensive?
Okay. Why do pay patient? Okay, firstly, of course, definitely is okay. For me, I'm very confident in prof.
Okay.
Yeah. So of course, if people ask me why they need to choose us, why do they need to choose us? Because we have we have prof with us.
Okay. All right.
Yeah.
Okay.
And sometimes I was told that this is what I was told by one of the patient, that when they went to public hospital, right, they sometimes they don't see the same doctor, you know.
Okay, yeah, I think that's for people who are on subsidy. So, but if you are if you are at a public hospital as a private patient, you will always see the same doctor. You can choose which doctor you have and which doctor you see, unless you're on subsidy. Yes, correct. Because whoever is free. Okay, so I mean, what difference do they get between? I mean, I know we've talked about lots of differences, but ultimately, what's the difference that they will get? I mean, because it is a very big decision. Why should I spend so much money and then come to a private clinic instead?
Firstly, okay, for a patient that they are paying for, okay, patient definitely you pay a price for high success rate.
Okay.
Yeah, and then of course with a better protocol, better lab, better embryologists, you know. Yeah. So instead of going through many IVF cycle, right? So the success rate is actually need to do only one time in the private clinic. Okay. So why not? And honestly speaking, even for me, when I speak with my patient, most of them actually they already completed they almost complete all the IVF from IUI, and they have completed their IVF.
You mean elsewhere, is it?
Yeah. I was actually quite surprised because when I asked them, I would definitely, because okay, very rare patients they come to us. They have not done anything at all. Very rare. The most is 3 months. I only have one patient that they are actually totally brand new in everything.
I see. So most people who come to you basically have done it before.
98%.
Wow. Okay.
When they came to us, they already completed 3-year cycle of IUI.
Okay. Wow.
Then after that, IUI they went to IVF. So they already completed. They already filled the second IVF already. You remember earlier I told you that my patient that unable to conceive for about
10 years. The one that you said 10 years. Yeah.
She has completed 3 cycle of IUI and completed 2 IVF. And miracle happened that she only took ovule health and she got natural conceive.
Wow. Interesting. Okay.
So there's one stage where our ovule health is actually out of stock.
Oh, do you have the cost of ovule health? So, I mean, can it be bought elsewhere? Can it be bought like at a pharmacy or only at your clinic?
Yeah, it's only at our clinic.
Okay. And how much, do you have an approximate about how much ovule health
I don't involve in the pricing of the ovule health.
Okay. All right. Okay. In terms of time-wise, okay, so for example, waiting times at public hospitals are usually longer, but we also know of many private clinics who have very long waiting times as well. How about Prof's clinic?
The most you have it 1 week.
Oh, no, I'm talking about waiting time, the appointment times.
Oh, appointment time. Okay, for currently, because we are actually overwhelming with our fertility package and our IVF package.
Okay.
1 week only lah.
Okay, 1 week is the waiting time for an appointment. Okay.
Yeah.
So how about, let's say if I have a booked appointment at, let's say 9:30 a.m. or whatever, would there be would I have to wait? Because there are some doctors who basically you have to wait like few hours. Okay, what is the waiting time at Prof's clinic?
About 1 hour plus. Okay, because Prof, because Prof he's very in details when he actually explain to patient. Okay. Yeah, he's not a doctor that he just blah 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 everything 20 minutes. Okay, next patient come in. He must make sure that his patient is in good hand. Okay. So he takes a long time in the appointment. Yeah, he definitely, because most of the patients come in, they are not medical trained, so there are things that he need to spend more time to explain everything more clearly. Understand. Yeah. So that at least patient go home, they won't be thinking, actually, what is Prof talking about? Oh, I don't understand. You see? Okay. Because patient is paying money to conceive, Understand. Yeah. Okay. In terms of, so we're coming to the end. Just want to answer some of the questions, see if you have the answers. One of the questions asked was, how does Singapore's private and public fertility services rank in the world? Oh, I think this is difficult to, of course, everybody. So, let's say your clinic, do you have people from overseas coming to your clinic, or is it just mainly just like Singaporeans and everything? Overseas, we have a patient from Indonesia. Okay. This so-called, we have also a patient from Australia. Oh, okay. All right. Middle East. So they come purposely to see. Yeah. Okay, interesting. Okay. Currently, because they are unable to travel. Yes. So usually, most of them is actually the first step before. Okay, what happened is for IVF for overseas now is actually we can actually issue an invitation letter. Understand. Invite them. So then after then they can come. Yeah. So this one had to go through the first study consultation first. Okay. Another question that we have is, why do you think your clinic has such high success rate statistics? Why? Yes. Okay, that is basically because I think why do we have high success rate? Yeah, I mean, like, because just now I think when we're coming back to the statistics or the percentage, right, the success rates, there's a very high, I would say probably between the 35 to 40 years old is a very high statistic, 70 to 72% is quite high for live births within that age range. So why do you think you guys are so successful? I think because we actually we have our embryologists, and of course our lab, you know, and of course, with Prof experience.
Understand.
Because everybody know that Prof is a very well reputed doctors, right?
Yes, yes, correct. Okay.
So,
Okay, why? Okay, we have one last question. Why frozen transfers have a higher success rate? This is more of medical question. Would you know the answer to this?
I'm not. I definitely. I mean, and maybe we will actually get the answer for you. You know.
Okay. All right. Okay.
Yeah.
So I'll check with you with the answer of this as well.
Mhm.
Okay, I think that is all. Okay, somebody asked one more question. Is there an event where you have to reject patients? Basically, you tell them, "I'm sorry, I cannot help you." Has there been cases of that?
So okay, we don't have
So
anything
basically,
that
who?
anything that if let's say there's a event that we need to reject a patient, then
Uh-huh.
it must be some certain medical condition that we can't help. You know what I mean?
Understand.
Because if let's say a patient, okay, let's say after diagnosis and then you know that we know that okay the patient cannot be conceived even through IVF, so definitely we have to reject the patient.
Okay. So you won't
Yeah,
keep on going and just for the sake of it.
yeah, precisely because
Mm-hmm.
for Prof practice is if he know that this patient will not be successful through IVF, he
Mm-hmm.
will actually stop he will actually stop or he will definitely reject the patient.
Understand.
Yeah.
Okay, I think that is all. Does anybody have any additional questions? Do type fast. Okay, if not, do you have anything else to add in terms of the differences and this and that?
There's nothing much. I think basically, if the viewer, if you do have any question,
Mm-hmm.
you can actually get them to send to you. Then we will try our best to actually to answer them.
Okay, great.
Yeah.
No problem. For whoever who has additional questions, do send to us as well. We can check the answers and get back to you as well. Okay. Thanks so much, Atarah, for spending time with us and answering all our questions. Hopefully, people have a better idea of the differences between public hospitals and private clinics.
Yeah.
Okay. Thank you. Thank
Okay.
you,
Thank you so
everybody.
much.
Bye.
Bye bye.
Bye.